All right, we're going to go ahead and get started. So hi everyone, thank you for joining us. Welcome to the first webinar of our new series, What is Branding and How Much Should I Spend? My name is Michelle Stevens, Marketing Team Lead here at Image Bloom. I'm joined by my colleague, Marina Martinez, as our moderator. So Image Bloom is a full-service marketing and recruitment agency. We specialize in digital marketing and marketing for clinical research sites and medical practices. So Marina will be gathering your questions as we go, and at the end of the presentation, we're going to have a quick Q&A session to address all of those. So please feel free to send over any questions that come to mind as we go, and we'll also be sending around the deck after the presentation. So just sit back, relax, and take everything in. All right, let's get started. So again, our topic of discussion today is branding. In particular, what branding even is and what goes into developing a good branding strategy. So it's our goal today that by the end of the presentation, you'll be able to understand the concept of branding as a whole. You'll understand the importance of branding your site or your practice. You'll understand your target audience, such as patients, research subjects, sponsors, or even CROs. And ultimately, we want you to understand that branding generates revenue and how to understand how to determine your branding strategy and budget. So before we dive in, we're going to go ahead and send out our first poll. Okay, so do you currently have a branding strategy in place? So we'll give y'all a few more seconds to answer that. Okay, so it looks like about 39% of you said yes, and about 61% said no. So that just gives me a good gauge of my audience that I'm talking to, and it looks like most of you guys do not have a branding strategy in place. So that's great. We're going to be talking about that today. So what is branding? So the first thing that pops into most people's heads are going to be these pretty recognizable logos I have here at the bottom, such as Nike, Amazon, Facebook, Google. But having a strong brand is so much more than having a good logo. So according to dictionary.com, branding is defined as the promotion of a particular product or company by means of advertising and distinctive design. But I would argue that that still isn't the full definition. So branding is who you are. It's who you are and what you represent. Your brand it's what your current and your future patients can expect from your organization, and it's what keeps your patients coming back even though there are other options out there. So what all goes into a good brand? First and foremost, you need to develop a consistent message that defines who you are and what you represent. The first step for this is, of course, your logo. I know I just said branding is more than a pretty logo, but of course your logo is important. So seeing your logo out in the community is what people will actually identify with. So seeing your logo should instill trust in them, and it should show your credibility. And with that being said, you need to put your logo on everything. So any kind of material that's going to be available to the public or to your patients or your customers, it needs to be easily recognizable as yours. So this includes pins, appointment cards, emails, community flyers, even those little reimbursement credit cards that you give to patients after a research visit. Okay, so your logo needs to be creative, but within reason. It still needs to be professional and clean. So I've included some examples of our Image Bloom logos here on the side. As you can see, we have our vector images that we can put on all of our materials. We have our logo that's in full color. We have one in white. We even have some for all of our individual surfaces. And we even have one just specifically for our webinar series. So while your logo may not be the most important thing, it is very important in developing your brand. Next thing is going to be your website. And so I cannot stress this enough. Do not skimp out on your website. These days, if a company doesn't have a good website, they're just not credible. And most of the time, it's going to be the first place a patient or a customer is going to go before they even consider scheduling an appointment with you. And so again, like your logo, your website needs to be professional and clean, but it also needs to be engaging. Be with the times. Include some moving elements, some interactive pieces, and even consider some live chat boxes or pop-up forms to gather information. And don't be afraid to look at your competitor styles for inspiration. Some people may think of this as taboo, but really you need to know where you rank with your competitors and if you're relevant. Your website also needs to be informational, but the last thing you want is pages and pages of text. So break it up. Make sure to have plenty of clean, well-placed images. I would even consider using actual staff and location images rather than stock photos. And then another thing to consider with your website, you need regular updates. So regularly updating your website can help increase your organic search engine ranking, or SEO. So what we recommend is adding a blog or a news page and updating that at least twice a month, just to keep those updates rolling. Updates on the website as a whole, on the other hand, only need to be done about once a year just to stay relevant. And so with that being said, we're going to move into our second poll, which is going to be, when was the last time you updated your website? And we'll give you just a few more seconds to get all of those answers in. Okay, so it looks like about 37% of you said last 30 days, 37% last 6 months, 16% the last year, and 11% in the last 5 years. So those of you in the last 30 days section, that's really great. We recommend twice a month. But those of you in the last 6 months, last year, last 5 years, definitely consider updating your website more often, and that will definitely help you with your organic search listing. Okay, so moving on. The next step in developing your brand is going to be your social media presence. So the next place I go, every time I go to a new place, after I visit their website, I go and see if they have social media. So everybody who's anybody these days has a social media account. I always even like to say that my 90-year-old grandma knows how to use Facebook. Okay, so we recommend at least using the basic platforms such as Facebook, Instagram, or Twitter. But some other platforms such as YouTube, TikTok, LinkedIn, even Pinterest have proven to be beneficial in growing a brand. And so for a strategy, we typically recommend posting 5 times a week, but really it's just as much as you can. And just a few little tips, staff pictures almost always perform the best. So if you and your staff are out at a community event or at a health fair, make sure to share it. It'll humanize you. People love knowing that you're real people just like them. And another little tip, videos under 15 seconds with little text tend to perform best after that. But ultimately, when you're thinking about your content strategy, you really need to be thinking about your personal pillars. And so your pillars are the 3 to 5 most important things you want your content strategy to cover. And so, for example, you could have a call to action pillar, such as enroll in our clinical trial now or book an appointment. You could also have an educational tier, which would just be interesting articles or videos that are relevant to your field. You could also have an informational tier, which would be information about your products or your services. So still not a call to action, but just letting them know that you do have these services available. And then you could also even have an inspirational tier. So some inspirational quotes or stories just to lift up your patients throughout the day. And then also make sure that your content is diverse. So not only do you want to fall into these 3 to 5 pillars, but you also want to give a diverse range of original graphics, maybe some memes, throw in some GIFs or videos, maybe even some articles or YouTube videos that you can share. And so with that being said, we're going to go ahead and move into our third poll, which is how active are you on social media for your business? Okay, we'll give you just a few more seconds. Okay, so it looks like 0% are posting daily, about 30% post weekly, 30% post monthly, and 40% have no social media activity. So we definitely recommend posting at least once a day during the weekdays, but really just as much as you can. So if all you can post is weekly, just do whatever is possible, but definitely post at least something. And then we'll just go ahead and move right on into our next poll, which is just something I was a little bit curious to see. So what is y'all's favorite social media platform? Just a few more seconds on that. Okay, so it looks like about 65% of you said Facebook, 15% said Instagram, 10% said Twitter, 5% TikTok, and 5% Snapchat. So that was about what I was expecting. Most people tend to be on Facebook most of the time, which is why when we are advertising, that's really the social media platform we tend to focus on. But some of these other platforms are just as good at building a brand, so definitely consider using them as well. Okay, so now we'll move on. So the next part of your branding strategy is actually selling yourself. Okay, so actually advertising. So you provide a service that people need, even if it's just clinical trials or primary care services. People need you. They may just not know that they need you. So get yourself out there, get in front of potential patients and potential customers. And so the great thing about digital advertising is that you can reach people where they already spend most of their time. So everyone is already searching about their condition on Google. So set up some search engine ads and drive traffic to your website. As I mentioned earlier, everyone is on social media. So set up like campaigns, grow your following, set up a lead generation campaign to gather some information on interested subjects. Even consider some more traditional forms of advertising, such as radio or television, maybe even a paid press release, or attending or sponsoring community events or health fairs. So whatever it is that can get you out in the community, get your name out there, do something. And so last but certainly not least, Your brand is more than your logo, it's more than your website, more than that awesome social media following. Your brand is actually your mission and your values. It's even the people that you hire. So ultimately, everything should come together and form one big picture of what your current and future patients can expect each and every time they have an interaction with your organization. Okay, so now that we've talked about what all goes into building a brand, now we're going to look into why. So why is branding important? Why do I need to go through all of this effort? And why do I need to be spending money on this? So first of all, branding builds credibility. So you could be the best, smartest, most expert in your field, but if people don't know you and they don't trust you, they're not going to listen to you. So branding puts yourself above the competition and makes your organization reliable and trusted. Next, it creates customer loyalty. So people are drawn to organizations that share similar values to their own. So if people like what you stand for and you're consistent, they're going to keep coming back. Branding also improves recognition. The more your organization and your brand are out in the community, so whether that be digitally or in person, the more people are going to recognize you as the experts that you are. And when you brand yourself, your organization stands out. So being recognized above all the other brands in the community, all the other research sites, all of the other medical practices, if you're recognized out in the public, it'll really put you that one step above the competition. But ultimately, the main reason branding is important is because it generates revenue. So getting your practice or your site noticed is the first step in acquiring new patients and retaining your old ones. So get your goals and your mission out there for people to hear. Invest in what you believe in and what you stand for, and the people will come. And then ultimately, word of mouth is the best advertising. Once people know what you stand for and they agree with it, then they're going to keep coming back and they're going to recommend you to their family, their friends, some random person online. They're just going to tell people and your business is going to keep growing. So now I'm sure you're wondering, now that you've heard all of this work, how much money do you really need to be spending on this? The first thing to consider is that every site and every practice is going to be different. So make sure to consider your individual goals and resources when developing your strategy. If you're starting from scratch, for instance, a new logo can range anywhere from $500 to $2,000 depending on rounds of edits and complexity. A brand new professional website build can range anywhere from $4,000 on up, depending on scope and again, complexity. Another thing to consider with your website is that purchasing a domain name and hosting your website on platforms such as WordPress or something else like that also has recurring fees that need to be considered. So the great thing about social media is that besides the employee time and effort it takes to actually go and post every day, essentially it's free. But we do recommend an average monthly promotional campaign of at least $500. And then if you can't do every month, we do suggest to at least do quarterly, at least do something. And then search engine optimization is essential to getting your website noticed. So you can raise your SEO ranking naturally, as I mentioned earlier. You can have those blog pages and news pages that you update twice a month. But you can also run search engine campaigns that range anywhere from $150 to really as much as your budget allows. So again, with this, we recommend monthly, but at least quarterly campaigns. And so another cost to consider is participating in or sponsoring community events. So the event itself could be free to attend, but a sponsorship could even go up to 10,000 plus, depending on the organization. But besides just your entrance fee or your sponsor fee, travel and employee accommodations should also be considered. And then again, don't forget your supplies. So backdrops, banners, flyers, pretty much anything that you're going to need for these health fairs or events needs to be considered when you're developing your budget. And so a well thought out branding strategy is imperative for all organizations, but it's not always easy, especially for small organizations that may lack resources. So this is where Image Bloom comes in. Our experienced marketing and design team have years of experience helping organizations just like you build successful brand strategies. So a typical package with us for the month, we would handle all of your social media management, which include your daily social postings for 5 days a week, professional creation of branding ads and original graphics. So this can include just still graphics for indication specific or service specific goals. We can also do GIFs, videos, pretty much any kind of creative content that you need. We can create that for you. We will also do 2 blogs per month to help out with increasing your SEO ranking. We will also do an email blast every month to those patients that are currently in your database. So it's always important to remarket to the people that you already have. And then we can also do press releases as needed, paid press releases, or just sending them out to local news stations, or even posting it on your website with those blogs to again help with that SEO ranking. So if this is something that you guys could potentially be interested in, feel free to contact us, and we can discuss your individual goals and even propose a strategy and budget that we think will work best for you and your goals. Okay, so that concludes the lecture portion of our discussion. Now we're going to open it up for questions. So Marina's been gathering the questions as we went, but if anyone else has any other questions, please feel free to submit those now. And then I am going to unmute the rest of my team, and we will have a panel type discussion.
Okay, so it looks like our first question is going to be, what's a vector logo and why would I need it? So that's a great question. A vector logo is actually a high quality logo that you can scale up or down depending on where you want to place that logo. If it's on a huge banner outside or even on a tiny flyer, it can be scaled down pretty easily and is great for the design team or your graphic designer or even website designer to place that anywhere.
Yeah, and it is also transparent, so you won't have that white background or that color background, and it'll just be your logo on whatever material it is. Okay, next question.
So next question is going to be, where are you finding the greatest success in recruiting for trials?
That's a great question. For us, I believe we have found the most success on Facebook lead generation campaigns. We can specifically target people that are interested in certain things, and we can target by age and demographic or geographic area. And then with the lead forms, people can enter their information and we can call them back at a later date that's convenient for us and also convenient for them.
Next question is going to be from David. What is an SEO campaign?
An SEO campaign, so that is search engine optimization campaign. So that is pretty much search campaigns on Google or Bing or Yahoo. And you're just putting in certain keywords that are relevant to your site, and those ads will pop up on the top of the listing, say on the Google search, and it'll just help drive traffic to your website.
Next question is going to be, can you talk more about press releases?
Sure. Marina, I'll let you answer that.
So depending on your site or your medical practice, sometimes we'll write press releases for our clients if they have a new study coming up and they want to promote that. We'll write a press release on that indication and get some quotes from the doctors or people at the site, and we'll release that to different news stations surrounding your city or your site, depending on where you're located. And we can also promote that on PR Web. So that's just another resource that we use to push out your press release depending on your needs and your goals.
Awesome.
So the next question is going to be, does your package include responses to ads and posts?
That's a good question. It does. So under our social media management, we will make sure to answer any instant messages or any comments or any reviews, good reviews or bad. We can go in there and manage those and leave comments as necessary or hide or delete them as necessary. And then if you run a study-specific campaign, that kind of thing is also included in our agency fees. So in short, yes.
Our next question is from Barbara. What's a reasonable budget for a Facebook lead form campaign?
Okay, that's a great question. We typically recommend, if it's just a branding campaign, we recommend at least 500. If it's a study specific campaign, we do recommend at least 1,500. Have you had any other experience, Marina?
For a lead generation campaign, I think it really depends on the indication and your target audience. So I think if it's a more difficult indication, then you might want to consider a higher budget. But I think that's just from our personal experience, and we're definitely willing to work with any budget that you're given from either the sponsor or just your out-of-pocket budget. So we can definitely work with either or. So next question is going to be, what do you think about creating a series of short videos on Facebook that lead through a sequence of awareness, solution, action through retargeting?
I think that's a fantastic idea. Definitely do that, yes.
Okay. And this one is going to be from Chris. Have you had any success with targeted website banner ads or opt-in email list campaigns?
So I personally have not had success with banner ads in at least generating leads, but every now and then, if you're running Google search and some Facebook lead gen as well, we may throw in some of those banner ads just to increase your visibility. But we haven't really had much success in actually getting leads from those.
And in regards to opt-in email list campaigns, if you're referring to MailChimp or any sort of other email platform that you use, we have had some good success with email campaigns, just because they are more personable and you can add multiple call to actions. So I feel like this strategy is really good for smaller organizations. And like I said, you can always specify it to your liking and send out to specific audiences depending on what you're trying to do. So yeah, I do think that we have seen some great success in email campaigns. Another question here from David. How difficult is it to get your staff to get more social? For example, using their pictures, videos, or obtaining patient testimonials?
That's a great question. I have ran into some difficulty of the staff being willing to provide the content, mostly if they just think it's time consuming. But if it's something that they're already taking, if they're already taking pictures of somebody's birthday, or if they're out in the community and they're just taking pictures for fun, that is always great content. So I would definitely recommend at least asking them if you can have it and share it. And then if they say no, then they say no. But ultimately it would be great and it would humanize you. So.
Okay. Next question is going to be, how effective is TikTok to the clinical study advertising?
So as far as advertising, we have not been able to set up ad accounts as of yet. We need to do more research. I believe they're only accepting certain fields, but it is great to develop your brand. So just to get your name out there. So you can't necessarily advertise right now, but TikTok is a great platform that they say anybody can go viral. So if you just post a video, even using some special hashtags like hashtag for you page, hashtag FYP, that'll definitely get you noticed and at least build your following.
Okay, next question is going to be, when making posts, how do you limit liability?
So how do you limit liability? So a rule of thumb for us is that we never post anything that could be coercive. So we always use language that we think would probably be IRB and sponsor approved anyway. So that's really our biggest thing. We don't want to promise anybody anything. We don't want to say that you are going to get paid for this. We always say you may have some reimbursement or something like that. So if you are using the wrong language, you could be held liable by the sponsor or by the IRB or even the patient if something happened. So just always make sure you're using that correct non-coercive language.
Okay, and I think that's all of our questions for now.
Okay, awesome. So thank you again, everybody, for your time. Again, if you're interested in learning more about Image Bloom's branding services, you can visit our website or give us a call at 866-YES-BLOOM. You can also reach out to me personally via email at michelle@imagebloom.com for any other questions or to set up a call to discuss your site's specific needs. And so again, we'll be sending out the deck shortly after we conclude here, so be on the lookout for that. And I hope you all have a great rest of your day. And don't forget to tune in to our next webinar in 2 weeks, which will be over when it makes sense to outsource your call center. All right, thanks everybody. Have a good one.